at Baystate Health, we actually serve a population of roughly 1 million patients across the Western Massachusetts region. Healthcare as an industry, as a culture, can absolutely be technology focused and can absolutely manage to use digital and data to deliver care. I think part of the reason why there was such inertia, has been such an inertia in healthcare, because we often say healthcare is 10 years behind in terms of technology. And a lot of it is it's steeped in tradition. It's culturally, sort of stubborn in terms of use of technology. And I think we saw that, we can really leverage digital in the way that we didn't think we could, and that providers, irrespective of age and what have you, they can actually leverage this to connect with their patients and deliver pretty dang good care. We're going to rely more, again, on these digital capabilities and these digital tools, and we're going to try to limit the contact where it's not necessarily important contact to have with a patient and let's say a staff member who's merely just asking questions that can be done online. And so there's going to be a lot more use of either app technologies, video technologies. I think you'll see waiting rooms change. I think you'll see even as far as parking lots change in how patients arrive, how when they arrive, they're instructed to engage with the front desk staff member. The personalization of medicine is going to be about how the consumer wants to consume our services. In the past, it's still been really about how the healthcare system, is providing its service and how you can kind of conform to that service. Like, we'll ask you to come into the office and do your visit, perhaps at a time that's not relevant or useful to you. You've got kids, you're picking them up at 3:00, but our only opening's at 2:40. Sorry about that, right? So now we've got this capability where it probably could be done, in the evening hours for 5 minutes, or in the morning and through video, and you don't have to pack yourself up and get to an office. I think it's going to become more of that level. So the consumerism of the future is really the personalization of healthcare today. The edge of healthcare, in my perspective, is really starting with the front door for the patient or the consumer. And let me define the front door as both analog and digital. And as we look at how the pandemic has really impacted our, again, engagement with the patient, we see that the digital front door is that much more important to the patient. And it's not really just about giving them a website to access or an app to access, but it is really creating an experience for them through the digital platform that is still empathetic to their situation, if you will, right? So that speaks to the personalization of healthcare, of course, but digital can certainly be a cold platform, and so we have to try to create a situation where, at that endpoint, at that edge, the patient still feels that they have a level of trust that they can provide to the health system, who, by the way, in this situation, that's the most sensitive and most exposed that patient is typically, right, during a course of care or during a visit. That's the most vulnerable that any person feels, and so we really need to provide them with the ability to feel comfortable. But from my perspective, the provider has a set of requirements that he or she is going to want at the edge, and that's information about the patient, information about their problem or their current complaint, their chief complaint, information about patients like them, certainly information about and data about how to treat that patient. And then perhaps even tools that enable them to leverage that information so that they can deliver better care. For the patient, there are a lot of items at the edge for them, whether they're receiving care from home or managing their care from home, or, like I mentioned, if they want to engage with us at the digital front door, how do we provide them with that information so that they can get through the course of their healthcare journey without stress, without too much confusion. So we think digital is a great way to do that. But not everybody has a device that they can use to connect in the way that we're connecting right now. Not everybody has Wi-Fi, particularly in the rural areas that we serve. They're still putting, they're still laying cable out there to try to get broadband. Not everybody has, unlimited minutes. And so to care for somebody virtually who's got a device like an iPhone, they may not have the unlimited minutes, and that one visit may take up a majority of their time or their minutes on their phone. And so we're trying to figure out ways to enable folks, consumers, to have access to Wi-Fi or to internet so that they can connect with us, and that could be through public means and or a way for them to just come to our health system and then hop on to, let's say, a guest network. We do see a lot of patients coming in now with their own devices, but also we've got a lot of IoT devices in our environment that either monitor those patients, interact with those patients, and essentially just collecting a lot of data about those patients and about the activities that they're undertaking inside of our hospital. And so, of course, as the sort of the leader of the technology side of the house, as well as leading the analytics initiatives inside of our health system, having all of that data accessible and continuously being collected is certainly something that I see as an asset, and certainly I see something as value, because we can certainly tailor our patient experience because of that data that we're collecting. But with all that data, and certainly with the ability to make our network accessible to providers, to guests like patients, there are a lot of security concerns for sure. And while we want to be able to continue to provide that capability to our larger user base, we also have to be cognizant of any nefarious activities that may actually impair our organization. So our Chief Information Security Officer and our Chief Technology Officer are really at the head of this initiative, and their focus is to continue to create convenience at the edge, to create an environment that enables folks to connect as they need to access data and information and devices, on-prem or remotely as they need to. But we are very much continuously aware of and continuously working on, basically ensuring that network is wrapped in a highly secure, sort of capability. And so we absolutely leverage monitoring tools to understand what the utilization is, across our enterprise. We have a lot of ITIL processes like our CMDB that enables us to understand what's connecting and where is it connecting from. And we've got a lot of, again, just a lot of initiatives that focus on connecting to our network, but always we have a security review, always we have an architectural review. So Aruba is a partner, a significant and important partner for us at the Edge, because, again, the future of healthcare is all about connectivity. And if you don't have connectivity, you can't have interoperability. If you don't have connectivity, you can't have information exchange. If you don't have connectivity, you've got disparate systems that are isolated and siloed. And so it's super critical that we have that platform, and and that platform has to be reliable, it has to be resilient, it has to be constantly on, and it has to be expandable and scalable. And that's why we chose Aruba, quite frankly, because we felt very confident that they could rise to the occasion with all of the different challenges that we had. And now I'm only talking about the internal use of it. Right now, you layer on top of that the million patients that end up coming through our four walls, our numerous four walls. And so you really have to have a platform and a partner who can scale, for the health system at that level. And I got to say, when we got this pandemic, when we had this pandemic come through, one of the things that came to mind first was, gosh, I hope we can continue to have our platforms, be reliable and on and consistent. And, that's what we got. We got great partnership from Aruba to ensure that reliability was there.